Hello, everyone. Welcome. We're almost to 5 o'clock. Hopefully everyone is settling in Zoom and familiar with this omnipresent platform that we've been working with for the past year. If anybody has any issues with Zoom whatsoever, please find the chat icon at the bottom of your screen and pop any questions or concerns into the chat box for our team to be able to chime in and give you some assistance. It's nice to see so many of you here with your cameras on. This is the first time that we will be meeting everyone, at least in a group fashion, so it's nice to see you all. I'd like to welcome everyone to today's event for admitted students to Population and Health Sciences. You have all been admitted to either the MPH or the MS degree program in Population and Health. And we're very, very excited to welcome you and start orienting you to the program. My name is Lisa Garber. I use she, her pronouns, and I'm the academic program manager for these 2 degree programs. I work closely with students on program planning and accessing services and resources. I'd like to invite everybody to take a moment to introduce themselves in the chat box here. Go ahead and share where you're logging in from and maybe a little bit of information about your education or work background. Make sure the recipient box shows everyone in the chat and that you're not just direct messaging co-hosts and panelists so that we can all start to meet each other in this group. We have a lot to talk about today, so while everybody is saying hello in chat, I'd also like to ask our panelists to introduce themselves. We have an hour planned to connect with them today. When our hour is up, I'll invite anyone who wishes to stick around for further questions and casual conversation to do so. Sharon, Dr. Cardia, would you go first?
Happy to.
Thank you. Oops, you're muted. It happened so quick.
I thought I just unmuted. Well, I'm happy to start off. So I'm a professor of epidemiology. I'm the director of the online program, and I'm the associate dean of education for the School of Public Health. I think I've been at the School of Public Health almost 23 years, 24 years. But I've been at the University of Michigan 35 years. I got my PhD in human genetics and statistics. And what I love about the University of Michigan School of Public Health and public health in general is the teamwork. The way that we know that the health of people and making the world a better place takes everyone. And there's just something about that every day I wake up and think, this is going to be a great day as I work with my colleagues from all different walks of life, whether or not it's the community partners that I have, or it's the students that I can see kind of the dream coming alive, or it's my 85-year-old PhD mentor who's still poking me and asking me, what have you done great today? So I love the University of Michigan. That's why I haven't left.
Thank you. We'll continue with our student panelists. Chris, I know you're driving. Can you unmute? Can you say hello?
Can you stay safe?
Can you stay safe? You can shake your head if not.
I don't know if you can see my head at this point. I think I'm just on audio right now. Sorry, everyone. I'm driving. My name's Chris. I am a second year MPH student in the program, finishing up in less than a month from now. I currently work as a nurse at University of Michigan, and I was a English teacher before that. So I have a bit of a varied background. My interest in getting into the School of Public Health, which I'm happy to elaborate later, was what Dr. Cardia had just talked about. It's the teamwork and collaboration aspect of public health that really drew me to it. And I wanted to expand my horizons a bit beyond just healthcare and medicine that I have practiced as a nurse. And the online program gave me the perfect means to do that while I maintain my professional life and do that full time, along with a family and all that. So it was a really great opportunity that I was lucky to have come along. But it seems almost surreal that that's almost over now, and entering a new phase. But yeah, it's nice to meet everyone. And yeah, I'd be happy to answer any questions that you may have.
Thanks, Chris. Keep driving safe. It's a good example of how a lot of classes go. Sometimes actually we log in from wherever we are. Sometimes that's the car, airport lounges when travel was going on, the backs of Ubers, etc. So good example. Kathy, how about, do you want to go next?
Sure. Yeah. Hi, I'm Kathy. I'm a second year student in the public health program as well. I love U of M. I love Michigan Public Health for all of the reasons that Dr. Cardia and Chris shared. I had always envisioned myself doing a graduate program at U of M, so it was a really easy decision for me. My academic background, I got my bachelor's in public health with a track in community health education from Eastern Michigan University. I'm also a certified health education specialist. Currently, I work as a program coordinator at a nonprofit organization in Michigan, overseeing community-based diabetes prevention programs in Southeast Michigan. I also do some work developing legislative advocacy materials for my organization. Going into the program, I knew that my strengths and a lot of my interests were in health behavior and health education, but I also wanted to expand and develop a new skill set in addition to building on those skills that I already had. So I am in both of the epidemiology elective series, which I'm happy to talk about later. And that has been a really good choice and a good experience for me.
Thank you. Christy, how about you?
Hi, I'm Christy Thomas, and I'm a first-year MPH student. I got my undergraduate degree and my dental degree. I'm a general dentist by licensure from the University of Michigan back in the late 90s. So I took a break to have life and family and so forth. And I decided during the pandemic, I've been in public health dentistry for over 15 years. And during the pandemic, thinking about all the work that needs to happen. And also I have a daughter who is a junior in the School of Public Health. We have lots of conversations about public health access. And so she somewhat, when she got her acceptance, she kind of inspired me to apply as well. And so my intention coming into the program is just to give dentistry, which I feel like doesn't have a voice in public health and in healthcare, to be able to advocate for dentistry. But I've learned so much, and now I'm kind of confused as far as what I want to do when I grow up. But I mean, this program has opened my eyes to so many things. So I mean, their possibilities are endless. So I look forward to completing my first year, going into the elective series, and then figuring out, do I want to actually stay in oral health, or do I want to go into another sector? So this is an exciting time for myself.
Thank you. And last but not least, Sophie.
Hey everyone, I'm Sophie. I'm a first year MPH student. I'm in Christy's cohort, and actually Christy and I have worked together on some extracurricular projects, which is one of the huge highlights for me in this program, is just the interdisciplinary nature of our program and the cool people you get to collaborate with. That's been the best part for me. I actually work in the criminal legal system, so not directly in public health, but I like to kind of bring those two disciplines together. And that's kind of the lens through which I approach the public health work. And I'm just excited for more collaboration with my teammates. I think we're just kind of like using that momentum to keep joining forces. And I hope you guys will join us as well.
Thank you. So I recognize that our leadership has already shared quite a bit of information during the school-wide admitted student programming that many of you have already seen our webinars, and that all of these recordings are all available. So today we'll really focus on the details that you might not learn elsewhere. I'll cover just a few frequently asked questions on these slides, and then we'll switch over to full meeting mode and just converse with our panelists for a little while. So we're still in the middle of our admission season for fall 2021, and we already have 30 admitted students here for this event. You'll be joining a student body of more than 1,300 students studying across the School of Public Health. And that means great opportunities for networking with peers and a huge alumni base. Population and Health Sciences is fairly new at Michigan Public Health. Our first cohort of 31 online MPH students started in fall 2019, and they're now about to graduate at the end of this month. So that's going to be a very, very exciting time. We welcomed our second cohort of 38 online MPH students in fall 2020. And as you might imagine from our panelists' introductions, our students have a really broad range of experiences and career aspirations. Some of our students started right out of undergrad, some are already working in health-related field, some are changing careers midstream, and some are getting ready to pursue sunset careers. We'll also be welcoming our first online MS degree students in fall 2021. So U of M and the School of Public Health consistently earn top rankings for the programs and resources we offer. And as online learners, you gain access to all of it. You'll be taught by the same top-notch faculty that conduct their research here and teach in the residential classes. And you'll be supported by our Office for Student Engagement and Practice, or OSEP, which is a team focusing on quality student life, enriching practice experiences, and successful career preparation and outcomes. I'm your main contact on the OSEP team, and I aim to connect you with the right resources at the right time. For example, before your classes begin, I'll be sure to tell you how to make an appointment with the SPH Writing Lab, how to use library resources to access journal articles, and how to use our terrific librarians for help with finding the right reference material. Throughout your program, I'll remind you to take advantage of virtual events and activities that will help you advance your career, especially those coming from our experts in careers and alumni engagement that focus on exploration, readiness, search, mentoring, and networking. And I'll also be working to promote health and wellness by sharing virtual well-being resources and activities for stress relief, exercise, nutrition, and mental wellness that are supported through units such as counseling and psychological services, university health services, mHealthy, and many other resources across the university. One of the main ways that I share this information is through our onboarding course. This summer, you'll receive an invitation from Coursera to join Onboarding and Advising. It's a self-paced course that will help you get started as a student in the program and become familiar with the Coursera platform where all of our courses take place. This course will help you get to know the university policies and procedures, including instructions for registering for classes, but it'll also be a resource to you throughout your studies. You can learn about many, many university resources available to you here, and then you can revisit the content often throughout your program. Dr. Cardia and I also host monthly group meetings on Zoom. And during these meetings, we'll talk about how things are going and what could be most helpful to you based on where you're at in the program or what you're experiencing right at that moment. Although you certainly don't need to wait for the next regularly scheduled meeting to connect. You can schedule one-on-one meetings with us anytime. Or you can turn to Slack. Slack is my #1 choice for sharing new content that I want you to know about and for chatting during office hours. I regularly post tips and resources here, but so do current students. And sometimes our population and health students will be your best source of information and support. Our program workspace is a really, really great place to ask for help or ideas, create study groups, socialize, and to strengthen your academic and professional networks. And so now I'd really like to shift our attention to our panelists in more of a meeting style. So I'll stop our share here so that we can just converse. I have a few questions already ready to go that can help get conversation started, but feel free to chat any questions that you have in the chat box or raise your digital hand and we'll call on you to ask your question aloud. So with that, Dr. Cardia, could you start us off and share some of your thoughts on this moment in time for the field of public health?
Yeah, public health is, top of mind because of the pandemic, but it's also going through a kind of revolution as we start to take basically the great technologies of big data and data science, start to think about how do we do, I'll call it much more precise population health. Just even in the last couple of years, what's happened is that the ability to take data and questions and put the raw results, whether it's cases or risk factors or environmental toxins, in a, I'll call it close proximity to people that are working in the field, has just blown people's minds that they can actually see what's happening in their communities and they can share it. And then people can make different decisions. We're doing this right now with the state, helping their community members actually figure out how to get vaccines to people that are feeling like they're hesitant or they don't know how. So it's just an incredible time where what has been like a big endeavor, populations, at scale, whether it's a nation or a state or a county, has now also got a lot of the power of what we see every day in our smartphones coming alive. So public health is becoming very personal and precise.
Thanks, Sharon. And Sophie, I know you have to hop off here in a minute to switch to a client meeting, so I wonder if you could comment a little bit on what you think makes this program so unique, perhaps compared to some of the other programs that you were considering this time last year.
Sure. Well, I think I really appreciate the flexibility of this program and how you can kind of pull together your different disciplines and kind of conjoin them all and make it what you want. I'm considering doing kind of two different tracks than I initially started. I'm looking more at like health, behavior, and education versus policy, which is sort of my traditional background since I'm in the legal field. But I think that that's kind of the beauty of this program is you can make it what you want. And as I've worked more and more with my peers, I'm like, oh, maybe I want to do environmental science. We just had an X-Pollinate, we call it, like a little networking event where Holly, one of our classmates, presented on her field of work, which was just so abundantly interesting that now I'm like, maybe I want to do environmental science and just have like a more meta focus. But I'm just learning new things all the time, working with ER docs on the front lines and learning from them, and dentistry, like Christy, I'm like, okay, this is top of mind now. I didn't realize how important oral health is. So I just mostly like working with people from different backgrounds and really exploring different avenues, different from my own.
Thank you. Dr. Cardia, do you want to follow up a little bit on a little bit more about the Pop Health learning experience and community?
Certainly. So Sophie gave me a great lead in there because when we devised this program, we knew that we wanted to start it with the foundations of the population health and then give people choice. So we have a ton of electives and elective series, and it's one of the ways in which we feel like we can offer both the breadth and the depth. And that the learning experience has been designed so that there's a lot of material you can do on your own, for instance, at the time that suits you, but then also the Zoom sessions that happen every week with your faculty members and guides are a time to actually start to, I'll call it, move with the material and better understand examples from people's lives and work, as well as, kind of some of the ways in which you take the concept, but now you have to practice it. And we try to emphasize the best we can, and this is where it's really important to have participation. What's the match to what you're currently doing or what you want to do? So a big part of, for me, the joy of this is to try to get the alignment with where you are, because you each come with different experiences. I was just looking at the chat, and you have a wealth of experience. And if you can bring that in, now what happens is that what's in the classroom becomes kind of multiplicatively helpful. And I loved, Sophie, you were just like, oh my God, maybe I'll do environmental health. And that's actually the funnest part of this whole degree program, is that it has a lot of surprises. I think for most people who think they're coming in for one thing, and then the world opens up.
What do you think, students? Does that track? I'm seeing nods. Do any of our panelists want to weigh in?
For me, I can actually still remember back when we could physically meet people and share the same physical space. Sitting down with Dr. Cardia in her office, there was this map of the program and all the elective series that we can choose from. And I had mentioned my educational background as a K through 12 teaching background that I had, and a big part of my nursing practice is patient education. So the health behavior, health education track really did attract me. But then, as she mentioned, I found myself getting really interested in environmental health sciences that I completely had not anticipated and never thought I'd be doing. And here I am in the second elective series for that. So I can speak to that it's a great program, and it could be a little overwhelming at the beginning. I thought it was kind of like just fun to have all those choices, and it can be a bit maddening to find out which direction you need to go into, but the flexibility is so nice. Like once you kind of fit your groove, and there's so much support and resources to help you decide that. So yeah, I agree with everything that Dr. Cardia said as far as that. It's this nice journey, and the program's really structured to help you do that.
And then I guess I would like to add, I'm in a kind of a quandary now. I'm just so stressed out. I'm backpacking for registration, and I just don't know what I want to do. I know I want to do health and education, but then I have an interest in health and policy, and I have an interest in environmental health sciences. So I literally woke up this morning and looked at what Lisa gave us. I mean, they give us so much information, and I'm really trying to decide what I want to do. So you come in thinking you know what you want to do, and you're just exposed to so much information, great faculty. You will never fall asleep in a lecture, even the recorded videos. I mean, even for the last class we took with environmental health science, our professor was just so engaging that, it just makes it so difficult. So you're just exposed to so much that, I think the hardest part is deciding which way you want to go.
Yes, it is. Thank you, Sophie. I know that you have to bug out. I just want to say one small thing that is important is that while you do have to pick a track to take courses in, we often open up the other courses because they're online. So if you want to actually have access to the other courses that you're not formally taking, we can do that. And that's one of the nice parts of this. And Christy, if you can't decide, then set up a time to talk. I'll try to move you through and move the needle. So
you mean I can't take them all? I can't take them all?
You could try. You could try. I see a great question about, do you have an individual academic advisor? And no, I'm the academic advisor for everyone. And one of the big reasons for that is that I've worked with all the faculty to develop the courses. And so I know the courses. And I also, because I'm the associate dean, if you need something, I know where to go. And we can get you hooked up with individual faculty. That is something that we do regularly. If you all of a sudden feel like, oh, I really want to work with Rick Neitzel on environmental policy, then I pick up the phone or the email and say, Rick, we've got somebody here who'd like to do some work with you. Is this possible? And to do projects or things like that. We've had a couple of great examples of that with some of the students just being like, "Oh, I really want to do a deeper dive in this faculty member's, kind of field." So we can make that happen too.
Thank you. Prasanna, I see your hand raised. Do you want to unmute? Go ahead.
Hi, Lisa. Hi, Dr. Cardi. It's a question about possibly taking classes if there's an online sort of experience in the Ford School or in the Ross School. Are there opportunities to do that? And if so, would those transfer into sort of, what's required for our electives?
That's a really good question. So we are just working through the details of that exact question. And so there's a negotiation that we're doing basically with Coursera and with the other schools. And the funny part of this is that it's the transfer of credits across curriculum that we haven't worked out yet. Right? So there are going to be some classes that it makes complete sense because a health policy class in Ford and a health policy class in the School of Public Health tend to be pretty similar at the graduate level. So that's easy. But some of the other substitutions will take some work and thought. And so I would say if you're interested, you have to sort of be proactive and give us some time to work through the details. The University of Michigan is large, and so sometimes it works and sometimes it gets stalled. So giving us time to actually work through it makes a big difference. But we're headed there.
So we have a question in the chat box about some insight into time expectations between full-time and part-time study. So I wonder if Christy, if you would just weigh in on what a typical week looks like for you. Would that be a good time to just talk through what it's like to be taking a full-time program plan right now?
Sure. For me, I'm the current director of Community Dental Center at the School of Dentistry. So that is a full-time position. And I also work with the Community Health Center in Detroit. So my life is full and I have 4 children at different age levels. So my life is pretty crazy. And so what I appreciate is to a week before the class starts, they release the whole course to you so you can look forward to see, how the schedule is going. And for me, at certain times, because we're in a pandemic, I took a vacation during, a critical week for me. Also, it describes how long the course material should take you between the lectures and the reading. So if there's a heavier week where they say you should dedicate 6.5 hours, then I can plan out my schedule for me during the week because I have other obligations. I'll get up in the morning and do a little bit, and I may do a little bit after work. I spend a lot of times on the weekend doing it. So you're able to see what the course load is like, quizzes and examinations and assignments you see beforehand. So you can, plan your life according to when you have time. The lectures are consistent. They're basically an hour and a half, one time a week. I block that time out to be able to do it. So it's very flexible. The instructors are very open and, great communication. So I really like the platform. I like I like the idea of being able to get into the classroom on the Zoom sessions and have those discussions, but I really like the platform, the Coursera platform, being able to listen to the videos and, if I want to listen to the lecture again, I just start it over, take my own different notes. You can make notes on Coursera. I really like it. I feel like if I would have had this like years ago, I'd have been a different types of students, but that was back before the internet. Let me not date myself. I really like the platform.
Thanks, Christy. Follow up to that. There's a question for you in the chat, Chris, if you want to talk a little bit about balancing family and coursework. We've got a new mom coming. And we just had our
boy.
fourth health baby born.
There's a new pop health baby every month, it seems.
Yeah, I found out I was pregnant, and then 3 weeks later got admitted into the program. So I was just definitely looking for some insight on balancing all of that.
Congratulations.
Yeah,
Thank you.
we were about 3 months. Let's see. Yeah, I had gotten admitted when I think my wife was like about 3 months pregnant. So it's the hardest thing I've ever done in my life. It's well worth it. I wanted to do this. I had a partner that supports me. Little ones are easy for a certain part of the study, and that's gotten more and more complex as we move along, but that's its own learning process. So it's not without its challenges, but it's definitely doable. And it comes down to your support system. So it depends on what work you do. I have a really great boss and coworkers. Like I said, my partner is really supportive and puts in a lot of hours when I'm putting in hours studying, but I would not have been able to do it in the residential program. Having to physically sit in a spot in a classroom, even in normal times, beyond pandemic times, I set my sights on this specific program for that reason. It wouldn't be doable otherwise. So the flexibility, like Christy was just talking about, of the platform, and the flexibility of the professors and all their support, it made it way easier and doable. And people just understand what's going on. So you can do it. It's a challenge though, for sure.
I have a couple of questions that I'm going to mash up together and just turf to any of our panelists that want to weigh in. There's some questions about, besides using Slack and LinkedIn, how are we connecting with peers? How collaborative is the program? Is there group work, case competitions, etc.? How does all of that collaboration, connection, networking work?
I think with Slack, all during the day, there's a message popping up in Slack. And, you get so much information. You learn a lot about people within Slack. A lot of the classes, they're group presentations. And I was, really down on group presentations until, I can't remember what class it was, but that really got me going, working with my peers. It was one of my classmates who's the ER physician. We were laughing because some of the classmates are the same age as our kids. So, it was just great to interact with different people and perspectives. And for Sophie and I and a couple of our other classmates, we entered into the first policy contest. We had a really great time working together, putting together a presentation to present. It got us a chance to really set up slides and really come together, and what I thought presented a great suggestion on increasing access to mental health services in the state of Michigan. So there's so many opportunities. The X-Pollinate, which they were talking about, we present different classmates. We actually have a House of Representatives, politician from Georgia, who just brings us so much information. So, from teachers to students to ER physicians to nurses to teachers, you're just exposed to so many people in different time zones. We actually had a student that was living, I can't remember where she was living, but when we had class, it was like, I don't know, it was like 5 o'clock in the morning. So, just learning from different people. This has been one of the best experiences that I've had. So I highly recommend that you come on in and join us in this wonderful experience.
It's fun how little coaching the students got before coming on this panel too. It's really nice to hear your comments.
I would just want to chime in real quick. We were the the willing guinea pigs in many ways with being the first year of the program. One of the things I really, if I could hop in my time machine and go back, would be to have everyone use Slack more. We didn't hit the ground running with my cohort, and it kind of got really sporadic. And I communicate directly with some of my classmates during electives with that, and I love it. But as a whole cohort, we never got on it. And I think it was just one of those things. But I would really recommend just diving full on into Slack, and email to some extent would be like the second tier. It's not, they just pile up though, and things get lost in the inbox. So Slack really is suited for this type of program. And it's a tool that I don't use it in healthcare, but like I know I'll be able to use it moving forward in my professional life, that it just helps organize workflows. So it's its own little skill that you can pick up for communicating along the way.
We even got the faculty using it, including me.
You're doing great.
Thank you. I'm
I
trying.
watch your Slack channel all the time. Looks great. I learn a lot from it. Thanks, all. So it looks like maybe there's a good case for switching gears into a little bit of insight into the experiential learning components of this program, the applied practice experience and integrated learning for the MPH, the research project for the MS. Sherry, do you want to kick us off on that topic?
The research topic for the MS or the applied experience, they're kind of.
Why don't you start with applied practice?
Okay.
And carry on from there.
All right. So the applied practice component of the MPH is something that has been a foundation of public health accreditation, and it's come in lots of different forms. For a couple of decades, we had internships during the summer that were a part of the regular plan. Our accrediting body shifted to something that was a bit more, I'm going to say, flexible in some ways, but then also very precise in others. And they've asked us to do, basically for all MPHs, what's called applied practice experiences. This is sort of 2 small projects done with somebody out in practice. So it can't be like inside of the university. And I think that's why the accrediting body shifted this. So it means that this is an opportunity for you in your own work to actually come up with an applied practice. And it could be everything as small as creating a fact sheet to actually, we've had some people that have worked with local public health and have done texting to moms that are in like a mom's program. We've had people that have worked with high schools to create, because it was the pandemic, basically step-by-step processes for how to hold band or other kind of in-person activities. We've had people like Chris who've written policy briefs for nonprofits. And we have both a database of partners that put projects in, but then also if you are interested in an area and you want to do a particular project, we work with you. And there's 2 of them, so we try to get them right size so they don't take over your life. That's kind of the main applied for the MPHs. They have then a capstone, an integrated learning experience, which tends to be a more in-depth project of your choice. Could be grant writing, policy briefs, policy studies, program plans, program evaluations. I'm pretty flexible. Something that actually would be useful to you in your own development is really what we're looking for. And, something that would help you in a resume or to stretch, a stretch goal is really what we're looking for that integrates across the courses that you've taken. The MS is a little bit different in its configuration because there we want to sort of practice research sort of skills. How do you take a key question with data analyze it, interpret it, write it up, because the sort of scientific writing and process of discovery and adding to the knowledge base of the world takes a kind of incubation. So what we have for an MS research project is we will have basically something like 3 or 4 major projects, and you'll find one that you want, and then you'll work basically in that project for um, 2 semesters. So a fall and winter semester, where you'll take it, you'll be in charge of analyzing the data the way that you want, and you'll be working with a faculty mentor throughout. One of the nice things that we've found is that having that kind of experience where, let's say, I don't know, you have several of your peers also doing it, is that the questions are big enough. Everybody has their unique way of answering that question, but you also get to learn from each other's mistakes or from each other's successes. And so it does kind of catapult you a little bit further in the research, I'll call it skill set, than just trying to do it alone, right, with one faculty member. So there's got some nice group, I'll call it learning that comes from that. And the hope is that if we do this well enough, we can get published papers, or we can get things that actually, again, are a launch pad in your career. And that's really kind of what we're looking for, is how do we get these assignments and this experiential learning to be of benefit to you and not just an assignment. I mean, you guys are all mature students. You don't really need another assignment. How do you get it to be in your own lanes?
Thanks, Sharon. I think it'd be a great time to hear a little bit from the students about favorite activities, whether it's Apex and ILE or elective series or projects that you've done. Kathy, do you want to start us off on that?
Sure. So I'll actually talk about a project that I am doing in my electives classes, but the ILE has been a really good experience for me as well. Not even just the project itself that has been a valuable experience, but just working with, at the risk of sounding like I'm sucking up, working with Dr. Cardia on that and just getting to know her and other faculty on more of an individual level and get that sort of personal guidance and helping me think through what are my next steps from this degree and how do I align my work with those. So it's been a really great opportunity to think about those things. As far as a favorite project, so I did both of the epidemiology electives series, and I've really enjoyed them both. And there's really been a lot of really cool projects in both of these elective series. My favorite project was in the Introduction to Spatial Epidemiology and GIS for Public Health course. We learned how to use R to create nice maps of different types of health data. So I made a few different maps demonstrating county level data related to opioid overdose death rates in Michigan. And it was a fun project, and I feel like I've gotten new practical skills out of that are marketable as well. So that was one really good experience for me.
Go ahead,
I guess I can add, I'm going to tell you my alias is Tom Gibbs. And it actually, and Sharon's laughing, last night we participated in Yellow Dig, where we are doing advocacy for prevention of opioids. And so we've created this community where everyone had their own alias. And so I am Tom Gibbs, and I am a high school principal. And I'm excited to see how this project is going to turn out. So to me, I think this is going to be my favorite one because this, I come from a long line of educators, so now I get to be a principal, and I can't wait to see how I collaborate with my classmates to be able to hopefully reduce the opioid epidemic, which is something that I'm working on as a dentist in the state of Michigan. So I can't wait to see how this project turns out. And maybe Dr. Cardia wants to say a little bit more about it because it's her classroom and her class experience in population health.
Yeah, I'll just say that one of the hardest things to figure out how to teach is partnership. And how do you take big problems like opioid overdoses and misuse in a state like Ohio that has a really high incidence. And so I got turned on to the idea of creating a simulation because somebody in the Ford Policy School does that with legislators, where everybody gets assigned to a legislator in, let's say, Michigan, or pick your favorite state. So I thought, oh, I'll actually go and look at what is in Ohio. And so we've got 35, what I think of as leaders in Ohio from different sectors, whether or not it's medicine, public health, school districts, police and emergency responders. And so everybody's going to populate a role, and we're all going to come up with basically proposals to further the work that has been done, let's say, for the last 7 or 8 years. And so everybody has to be inside the professional role of somebody who is actually doing the work in Ohio today. So you can look up your person in the news. So that's kind of cool.
Great, thanks. Chris, I don't want to leave you out. Do you have any favorite projects?
I do, yeah. Very briefly, for my 2 Apex projects, I did a policy brief for the Michigan Fitness Foundation, I think the organization is, and that was in regards to nutrition and the SNAP program. And I had always been interested in public health and nutrition, so that was a good opportunity to do that. And then I worked with the University of Michigan Dearborn campus to help put together a curriculum for they run a youth training program out of Southeast Michigan to help youth become more familiar with air pollution in their area and monitoring that. And with my education background, I was able to help them put together a curriculum plan to do that. And that was really rewarding. And I live in Michigan, so it's in my own backyard. And it was a great way to connect with youth via the project I was helping them do, that they would work with the youth for. And then for my ILE, I actually continued with those community partners to write a grant for that same air pollution monitoring program. I've always wanted to learn how to write a grant. In my other graduate studies, that wasn't going to be part of the curriculum. So I would have had to do that, out in the field. So I really appreciate being able to get to do that in an academic setting. Outside of all that, because that's all really involved, and those are like long-term projects of the program that you're kind of working on along with other courses. Course elective wise, we just did it was an environmental health, environmental justice and policy course, and she was one of the best professors I've ever had. I've been in school for like 7 years, what she personified, and I think what's across the whole program, is that like they had said, there's not just assignments. Yes, there's like quizzes and like real quick checking things, but there's deliverables that you once you create this fact sheet or a policy brief for a course, like that's something that goes into your portfolio that like you can use later on. It's not just homework to do. So in particular, she has do a couple of podcasts. We wrote a policy brief within that course. We had to make some videos and fact sheets during the Zoom sessions. It was really integrated into the course material, and it kind of stretched our minds in a bit of different ways rather than just doing like term papers or homework assignments. So that handful of assignments was probably my favorite set outside of the longer term projects.
Thank you. Sure. And I see that you made a comment on some of our health disparities research that's going on at the school, and that's a great thing to bring up. We also have some new massive open content courses available. If you want to check out some of the social determinants of health content, we have them open and available on Coursera now. And Sharon, you have one of those courses. Cleo Caldwell, I think, has one of those courses, who's one of the two of the leaders in that field. And we can share a link in the chat in a little bit to some of that content. But it would be a really fun time, I think, if you feel like checking some of that out, to see what it's like to take a course on Coursera too. Get to test the platform out a little bit. There's some questions in the chat around career development. Chris, you've used the careers team recently. Do you want to comment a little bit on how engaging with careers works for you?
Sure. My first contact with them was during the first year of the program. Again, I'm a nurse, and I hadn't really decided when I got my MPH how I wanted that to work with my background I already have. So I went and just chatted with them, like what interests I had, what I was hoping to get out of the program, and they were able to point me in a few directions, give me some homework to research what I wanted. I really didn't touch base with them. I just kind of, dove headfirst into the courses and all the content to get a better feel for what I did want to do. And right around the time that some fellowships through the federal government started popping up, I got back together with them to help work on my resume, and they kind of walked me through like what's the difference between a federal resume and a one that I would apply with to an NGO, for example. Important differences, and I had countless sessions where I would like edit and then I go back with them and then just edit it over time. And I was really happy with that experience. They were super supportive and knowledgeable. And then any job applications that have come up where I don't quite know maybe what the application is telling me of like what type of job it would be or if I'm qualified for it, they'll like sit down and look at it with you to see, is this maybe the best fit for you, or, is it really saying what it's saying? And I found that very useful for someone who didn't necessarily know, I think how Christy said, like what I wanted to be when I grew up, coming out of the program. And yeah, they are just so, I guess everyone in the program is so supportive. It's nice to have the professors to bounce ideas off of. However, they are professors and they're researchers, so that's one side of it. And they've been, they've had jobs before they were professors. Obviously they have field experience, but it might have been longer since they're in the situation I've been in. So I appreciate the career services having like this very up-to-date knowledge and like the pulse of like what the industries are looking for and what they want to see on a resume. And so I can take the best of both worlds, all the accumulated knowledge of my professors, and put that practical application that I'm getting from the career counselors into action. So I really appreciated their services.
Thank you. Any other major resources for our students and for Sharon? Are there other major resources that we should be highlighting for this group that have been really useful to you so far? Christy, so far, Kathy, at the end of your program as you're facing graduation in a few weeks this month?
Well, I like to say this, and I hope I don't put Lisa too much on the spot. During the first semester, I had some personal issues, and actually I was just reaching out to Lisa to kind of just tell her, what was going on, and more from an academic standpoint. And what really impressed me, she actually asked, how are you doing? What can I do to support you? Let me give you this resource, because it sounds like what you're going through is probably affecting your overall mental health. And so the fact that, at this stage of my life, someone is asking me how I'm doing, can they give me resources? And it just really made me know that this program is really here to support me. And so the resources that I needed going through that particular tough time were there. So I want to say, Lisa, thank you so much for just that support during that time. And that just shows you about the program. It's not just about the academic, it's about the whole student. We all are gonna have lives and we're gonna all be going through things that maybe necessarily your classmates don't know, but you have that support to kind of give you the resources you need to make sure you're successful. So thank you again, Lisa.
Thanks, Christy. You're so welcome.
I second what Christy is saying. Lisa, you're fabulous. And our other professors, I don't think I've had a professor that hasn't said, please reach out to me if you need anything academic or otherwise. So they're really there, to help guide you through making all of your academic and career choices. And they're there to share that experience with you. I found that really valuable. Another thing that's been really valuable for me is just the plethora of networking opportunities. I wish I had taken advantage of these sooner, but I've really just started doing that this semester as things have been wrapping up. One event that you would learn about as you start getting various newsletters and things are public health perspectives events, where some leader in the public health field, whether they're from U of M or another organization, comes to talk with current students and faculty and others to share basically their journey and how they got to the position that they're at. I found that to be a really valuable experience in learning from those that are in leadership positions and thinking through like, okay, how do I get there? But also just networking with other like-minded students and meeting other people is always a good thing. So that's been really valuable for me as well.
We also have an outstanding library system and informationists, and they are incredibly helpful. So I even use them. It's just an email away. And it just opens up a world to be able to have access to the library systems that we do, and the people that can help you navigate them for projects or just even if you have an interest area. So I want to put a plug in for the libraries.
They became very, very busy this past year with everybody needing remote access. They got very good at delivering all of those services remotely. They were already doing it for our online programs, but really, really got efficient this past year. Well, I want to be mindful of our time. I know that we're approaching the 6 o'clock hour. There's a couple of questions that I think we've got to address here. Around determining how many courses you take each semester, if you have to declare it ahead of time, if you can do part-time, if it looks full-time, what all of that looks like. So Dr. Cardia, would you be able to address some of those pieces?
Sure. So we have devised the program to basically be 5 semesters and have in there, what do you take the first year and the first semester and the second semester, so that you can actually get to the elective series and then sort of pick your own adventure. But for instance, if that was too much, we can extend the program out. And we do indeed have students that, for instance, they can't do it in 5 semesters because of things within their job. For instance, we had somebody who was going through a flight training in the Air Force and just could not actually take the first couple of courses in the first semester. So they're going to take 3 years, and that's their trajectory, and we're just fine with that. We'd work with you if you wanted to take an alternative route to make sure that you had prereqs and you had, basically kind of the optimum schedule. And Lisa and I do a pretty good job of being creative. So we do set out the course that you need to take in terms of the core, and then you get to pick the electives, and but there is flexibility.
Thank you. So as we're approaching 6 o'clock, I just want to mention that at the end of this event, we're going to follow up with an email on Monday, sharing the recording so you can come back to it, and contact information for further questions. I know some of us planned to linger. I always like to leave room for those who want to stick around in the room after an event and stick around and ask questions. So if you'd like to remain on to ask additional questions and continue the conversation super casually, please stay in the meeting. Otherwise, thank you so much for joining. I recognize if you have to hop off to your next thing, that's not a problem at all. It's been so nice to meet you. And I look forward to working with all of you as you go through making this decision and hopefully enrolling.
Good to see you. Thank you. It's so wild to see all the boxes rearrange as people like start moving off of the panel.
Yeah, settle. Like before I open my eyes again, let's just let everything Tetris itself together again.
Thank you, Christy, Chris, and Kathy.
Yeah, thank you all so very much for
Of course.
for your participation. It looks like we've got a couple people who might have a couple lingering questions. Just feel free, we can keep this casual, feel free to unmute and let's chat. Or you can type. I'll still watch the chat box if there's.
Hi, everyone. I just had a quick question for Chris. You talked about career services, and I was wondering, did you go in person or was this the help they gave you through email? Like,
You caught me at a weird time because there's a pandemic going on. In 2019, so the first fall of the program, I went to their office and met them, but I could have met them electronically at that point, but I live in Ann Arbor, so it wasn't a big deal. Since then, I've just done Zoom sessions with them, and those are either it's a website that they have of their own, and you can go through and book an appointment with a counselor. There's that way. They also have like walk-in hours that sometimes I'm on my lunch break at work, and it's like, I think it's like Wednesday and Friday. You get like a quick 15-minute session with them to do it that way. And backing up, actually, you can actually pick what type of appointment you want with them. Like you can tell them, I want to go over my resume, and then you're going to do that for a half hour. Or I want to just go over career opportunities for 15 minutes type thing. So it's all done electronically now. We'll see how things are this year, but they're really well set up to do that. So does that help answer your question?
yes, thank you.
Mm-hmm.
Reed, you unmuted for a second. Did you have a question? Or sorry.
I have a follow-up, I guess, to someone asked a question right at the end that you were answering about the schedule. And so Lisa, I know you and I have talked ad nauseum now about the way that the program is set up. And I was kind of under the impression that it's a block schedule almost, that you're taking one course at a time in this sort of part-time, full-time special category thing where, because I came away from the conversation with Lisa that you're a full-time student, you're still going to get 4 classes in this semester, but you're not going to take them 4 at a time. You're going to take them this class and then this one, and they're sort of blocked out. Okay, so that is accurate.
That is correct.
That's the way it was designed. Okay.
Yes, that's the way it's the place where there is a bit of flexibility and variability is in the elective series, because not all the elective series are lockstep. They have a different cadence because we've got some elective series that are sort of like 2 credit, 2 credit, 2 credit, 3. Some that are like 3 credit, 2 credit, 3 credit, 2 credit. I mean, so they do different things. And some of them have decided, oh gosh, I couldn't possibly do this in 6 weeks. So we have 2 8-week. So there's a kind of variety in the elective series that you don't see in the core.
And with that overlap, I guess, in the elective series, you're still I guess even if you have an 8-week elective, let's say,
Mhm.
you might only end up having 2 weeks of overlap with the start of another course.
Yeah.
Okay, so that makes
We are
sense.
trying to minimize overlap to the best of our ability.
That is what I came away from the conversation with Lisa, understanding that those instances of overlap do occur. And Christina, I think Lisa has actually sent me the sample course schedule, and it's just always nice to reassure that what I've come to understand amongst all of the programs is right. Yeah.
It can be challenging to keep track of them because they're all different, right? So if you're considering multiple programs, this schedule, I think, is probably a little bit unique compared to some of the others that you see.
And it's a pro.
A little bit with EPID, right? When you were taking your EPID electives last semester, there was like a 2-week overlap. Is that right?
That question was directed at me. I didn't hear the beginning.
Yes, I'm sorry. So when you were taking the electives last semester with epidemiology, you had like a 2-week overlap with some of those electives, right?
I believe so. And then in this semester, there was a longer gap. So it just depends on the class. Like this semester just happened, we had a shorter class at the beginning, a couple weeks off, and then a longer class rounding us out. And the last semester, there was a little bit of overlap. So it just depends. When there is overlap, it hasn't been more than like 1 or 2 weeks at the most.
It sounds like that wasn't too traumatic. If you're not like, yes, it was October 1st.
No, not too traumatic. And I mean, you'll find that your professors recognize that you're, a person that has a life outside of class and has flexibility in that. So I haven't had a problem coming to a professor and saying, hey, this project is a priority for me, but also this other project is due. So can I have an extension on yours? And that hasn't been an issue to have that kind of flexibility.
Yeah, because the faculty need the flexibility too to do all the grading. So we don't mind giving it.
It's very considerate of them.
That's exactly right. It's a little self-serving. Holly almost asked a question.
Yes, sorry, I have a toddler throwing pasta, so that's why I've been off all of the things. I'm super excited to be in this room, and thank you for everything. This has been a very helpful session. My question, I'm kind of in this weird place where I'm unable to do a residential program because of some personal stuff that will resolve, but I want to get as many things that I could have gotten despite being in an online context. And so one of the things I'm looking for is the ability to do research. Specifically, I think you all call it CSEF. I don't, yeah, okay. So I was just curious what you felt about like the atmosphere relating to receptiveness to online students being able to do research. Like, is that a realistic want? And how would I go about doing that?
So there's a couple of different things that immediately pop into mind. One is that if you sort of start with just even talking with me so I can figure out kind of what aspect of the social epidemiology and population health you're interested in, because we have some individuals that are interested in the mental health aspect. Some of it is within the sort of core epidemiology. Some of it is in tobacco and international work. So trying to get a kind of a match, and then basically finding the right set of faculty to talk with. And usually what I've done is I get to know you a little bit more so that they can see what that relationship could be. It's easy when you take a course from somebody. So that one is a no-brainer. It's when we go outside of that space that it becomes a little bit more challenging. And I'm not sure it's any more challenging to an online student than a residential, because the faculty are like big wandering cats. You have to kind of get in front of them and, kind of be directed at what they want and what you want so that they can be like, oh yeah, that makes sense. Have them contact me. So I'm a little bit more of a matchmaker in those kind of situations, but we have had online students working with faculty on kind of more of the research side of things. And the perception of the online students are really quite positive. That you know, tend to be much more mature in your kind of experience base and even in your intellectual formation of the field, because you've been out in the world. And we have a mixture in the residential, but we also have some students that are coming just from their undergraduate. They just haven't had enough time to actually get the experience that says, oh, well, I know how important this knowledge is. So they look at it like, oh, it's just an assignment in biostatistics. And you all look at it as a tool to solve a problem. Right. So the faculty recognize the difference.
Thank
It's
you.
just a matter of time.
Bye.
Oh yeah, there's the toddler.
There's the toddler. He would like me to go. Thank you so much.
Thank you
for joining us.
I'll bring my little dogs. That'll equal it out.
Mine was just scratching at the door. I think he can sense when something's starting to wrap up a little bit. He's like, all right, that means walk. Let's go. Any other final questions here? Reed, you unmuted for a sec.
Yeah, I'm that person. I always have questions. My question actually is specifically for Christopher, because I am a current Fed. And so when you were talking about the fellowship opportunities potentially that you were looking at, I just wanted to ask/recommend, if you haven't already. I think the application cycle has closed long ago, but I came through the public health associate program at CDC, and I cannot recommend it enough. It does require location flexibility, but if you've not looked into that, or if maybe you have flexibility in the future, it's a pathways program. So you have to apply within, I think, 2 years of graduating. They don't care with what degree. And if you've not looked into that, I just wanted to recommend. I had a wonderful experience. I was in Cincinnati doing school in adolescent health and community and environmental health there, and then got hired full-time with NIOSH. And now I work in HIV/AIDS prevention. So it's just been a very neat journey in public health to get started with. That wasn't a question. That was just a comment. I'm sorry, Christopher.
That's I was waiting for it. I was like, the question's coming. She said
Good.
it's coming.
Like,
No,
did you apply? Did you
it?
know about it? Yeah. Have you considered? Thanks, Sharon. That's it.
No, thank you for that. I looked at that. It won't work out for me, but yeah. But there are a lot of other ones through the CDC that are just amazing. So yeah, we'll see if that's where the winds blow. But yeah, it looked like a great opportunity.
Yeah, and the location flexibility, I think, is a big one for a lot of folks. If you don't have that, it's really a no-go. But I was coming out of undergrad and it was beautiful, so worked out.
Atlanta's nice.
I was placed in Cincinnati though, so.
Were you really? Well, Cincinnati's also got some very deep beauty to it, that part of the country.
It's charming. They have the best fall I've ever seen.
Yeah.
Look at this. These are the kinds of connections and networking that happen in our cohort all the time.
Are we
demonstrating your point?
That's exactly right.
True. And this is one reason we like to keep the cohort a little bit small, right? I mean, I know sometimes people are surprised when I say, oh, we're shooting for a cohort of, you know, maybe 40 or 50, and it seems small for an online program, but it's because then this kind of thing happens.
Yeah, this is the fun part. It gets too big, it gets too much like a manufacturing department. And that's not the University of Michigan. You ought to be able to go anywhere in the world and say, go blue. And within about 10 minutes, somebody else would be like, go blue.
When we got packages of like masks and other protective equipment for COVID, I wear that U of M mask like everywhere I go now, and everywhere I go now, somebody's like, go blue. You go to U of M, tell me about it, like that kind of thing.
Yeah,
Pretty
it's
cool.
very,
Alumni everywhere.
yep. Yeah, I love wearing my sweatshirt because it does the same thing. Be walking in an airport and you just hear it off in some corner.
It can take a minute to get used to, I think. When I very first started, I was a recruiter for U of M many moons ago. And so I was always branded, always in an airport, and people were shouting at me. And I was like, how do they know?
How do they know? It takes a little while.
Got it now. I'll figure it out. Any other final questions? Thank you so much for joining us. It's been a pleasure to get to know you. Keep us posted. We look forward to seeing you in the fall. Thank you, panelists. It's been delightful to see you all again. We have advising on Monday if you want to drop in.
Sweet. All righty. Take care.
Thank
Have a
you
great
so
weekend.
much. Looking
Thank
forward to
you.
scholarship info next week.
Next week. Yeah. Sorry for the delay. Coming soon.
Coming soon.
Coming soon.
Alrighty.